We want to make it better for people with learning difficulties.
Our aim with this project was to ensure that service users are able to access hospitals, health and social care services without the need to take a parent, carer, support worker with them, which many of them do now. As a result of what we were hearing, which was around lack of accessibility, lack of staff understanding their needs, communicating effectively, we wanted to get service users more heavily involved in improving those services and influencing local service provision.
My specific nursing background isn't in learning disabilities, so it's always helpful to have insight from other healthcare professionals, but also from the users of the service. They have a unique insight into what they need and how services can be adapted to help them maintain their independence and to make them more accessible.
We were really clear from the start that people with a learning disability and autism needed to be right at the heart of this project. We appointed a team of 6 people and we conducted some training. As part of the training, it became clear that we needed to develop an easy read document for them to use during the visit, and that really helped as part of their training to focus on the questions they were going to ask and what they were going to look for in particular around accessible information standard and staff communicating with them.
Started off by showing them around the department, just a brief tour, letting them know what we did and how we do it, and then really I just sat back and answered any questions that came up.
They did a walk around our practice. They had chats with our reception team to understand what they were aware of and what their knowledge was so that they could identify any skills gaps.
We discussed our findings, drew up a report and highlighted recommendations. The reports were fed back to the services who were able to respond, and most did really positively with action plans for improvements.
And one of the key pieces of feedback was, wouldn't it be great if there was a map? So we sat down and we created a map using just a simple Excel spreadsheet and sort of pictures and diagrams and arrows. Most practices will be using a computer system like System 1 or EMIS, where documents are stored on the system. So the key thing that we did was we looked at our documents that are most used, are most sent out, and we looked at those documents and we decided that we'd make them all unified, and that just takes 5 minutes per document. So even if you're focusing on 5 or 6 documents, that's sort of half an hour just to change the font to Arial 14. It's really not that difficult.
What one thing made you really proud from this work?
We got this reply.
And it's an easy read.
So why is that so important?
It shows us they listen to us.
What one thing made you really proud about this work?
To making a difference.
I was really bad that the doctor listened to what I had to say.